This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Welcome back to Your Health, Your Wealth. I'm Chuck Taylor. Each and every Wednesday morning at 6:30 a.m., we get together and talk about
your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Good morning to you. Chuck Taylor here with you. And each time I get together, I love to talk to you about your health, improving it, loving to get you back to that idea of healthy living and also taking care of yourself. So these ladies are here, and we're going to talk about dialysis and some things that you really should know about. Good morning, ladies.
Good morning. Good morning.
Go ahead and introduce yourselves to our listening public.
My name is Dr. Raquel Lowe-Jones. I'm a consultant nephrologist at the HSA. Happy to be here.
My name is Erlin McLeod. I'm the Dialysis Nurse Manager. I'm happy to be invited to the radio station to raise awareness about kidney disease and how we can prevent progression of the disease.
Exactly. So when we talk about kidney disease, there's so much underlying with it. As I said, it regulates so much in the body. Tell me how we can see some signs of and symptoms of kidney disorder before, because we always want to check in with a doctor, but maybe there's some telltale signs before that manifest, Doc.
Sure. You started your introduction stating that the kidneys are there working, and it is one of the most important organs in the body. It's a constantly working, constantly filtering multiple liters of blood per hour. And so one of the big things that we take for granted is that kidney disease is silent. You have no symptoms in early disease. And so I implore many of your listeners to go out there and get screened for kidney disease, especially if they have risk factors for kidney disease, which are hypertension and diabetes that are uncontrolled.
And these are things that, sadly, in our community are very prevalent. The numbers, I looked, just kind of prepping for this, the numbers have been on the increase rather than the decline. So with that being said, hypertension, overweight, things of that nature tends to lead into kidney disorder.
Absolutely. And we have to realize that there are over 850 million worldwide who suffer from some sort of kidney disease. It is definitely an increase, not only in our region in the Caribbean, but also here in the Cayman Islands. And it's quite shocking to say that a lot of younger persons are developing kidney disease and kidney failure. So it is a disease that has no age restrictions. And so that is why it's very important, if you have risk factors for kidney disease, to get screened for it, which would involve a basic blood test to check for creatinine, which is a muscle protein byproduct that is found broken down by the kidneys. And we also check for protein in the urine. And so by that, we implore your listeners to check their urine, checking for blood, checking for burning, and checking most importantly for bubbles or froth, which is the passage of protein in the urine.
So kind of getting stated that once you realize that, I don't want to say the end result is always dialysis.
All right. So we don't want persons to be fearful. We do have modalities out there that can preserve life. And the preservation of life in patients with kidney failure is through dialysis. We do have two modalities of dialysis that the HSA is offering. I think maybe your listeners may realize the more common modality we call hemodialysis, which is a blood purification process that patients use, and they're attached to a machine for a few hours. Mm-hmm. It is an ambulatory service, so they're not admitted in the hospital. And we are trying to promote peritoneal dialysis, which is a more gentler form of dialysis that is used through the lining of your abdomen, which is the installation of different concentrations of basically sugar water. And the benefits of peritoneal dialysis is that it can be done in the comforts of your own home, and it doesn't restrict you. For those who work those who have a busy lifestyle, and even for children
Wow.
that can still attend school. So it is a modality that we're pressing upon to have your listeners be more aware of, because there is the only treatment for kidney failure is really kidney transplantation. So we here at the HSA will use dialysis as a buffer until you can get a kidney transplant.
Wow. So these two options, I've only heard of the one, which is the first one, the blood. So how common is the second one?
So in Japan and Asian countries, and even Canada, peritoneal dialysis is the first option, or the first dialysis that is offered in those countries, and you're actually penalized if you offer hemodialysis. Okay. So Hong Kong, Japan, Canada, it's first line of renal replacement therapy or dialysis. So it is common. Mm-hmm. In the US, being that our closest neighbors, it is not as common. Hemodialysis is more common. However, during the COVID pandemic, the US have had to rely on peritoneal dialysis because there were not enough hemodialysis machines for patients who developed acute kidney injury, meaning you've never had kidney disease before, and because of COVID and your other underlying illnesses, you develop kidney failure.
Due to other external factors.
That is correct. And so they had to draw upon peritoneal dialysis because they're able to do it in the comforts of their own home.
Wow, Doc, that's some really great information. Good to know. We're going to take a quick break and come right back talking about kidneys and the kidney functions, and also how a dialysis works. When we come back, I'll ask Nurse Erlin about being a dialysis patient.
I'm free to live my life, yeah, yeah. Free to be me, yeah, the way I wanna be, doing the things that I wanna do.
I'm living my life, hey, BAF for life. Yes, I'm living my life, hey, BAF for life.
For life, BAF has got you covered.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, tells us about mosquito-borne diseases.
Mosquito bites can range from annoying and itchy to deadly. And the only way to be safe is to avoid a bite altogether. Today we look at some of the common mosquito-borne diseases and how to prevent them. Remember to like and share this video with a friend or relative. And while you're here, go ahead and click the subscribe button. Now, in the last decade, we've seen diseases such as dengue, Zika, or chikungunya sweeping through our population, with patients exhibiting symptoms such as fever, headaches, muscle pain, joint pain, and a rash. These ailments were all spread by the Aedes aegypti mosquito, which can be easily recognized by black and white markings on its legs. It's also called the yellow fever mosquito because it can spread yellow fever as well. But why do they bite? Well, the females require the proteins obtained from the blood of humans and other animals in order to mature their eggs, and that's why they come in for a tasty meal from us. Mosquitoes are vectors, so they get the virus from an infected person, animal, or other mosquito and then pass it on to us. Not all mosquitoes carry the pathogen that spread the diseases we mentioned before, but there's no way to readily tell which ones are infected, so it's best to protect yourself around the clock. Here are a few tips to help you prevent mosquito bites. Erect mosquito screens on your windows and doors, or if you already have them up, check them regularly for any breaks or damage and quickly repair them. Use insect repellent containing DEET whenever you're outdoors. Wear long sleeve clothing. Remove standing water and other mosquito breeding sites from around the areas in your home. Mosquitoes breed in stagnant water found in places like your drums, plastic containers, tires, flower pots, and old bottles and pans inside and around the yard. Get rid of those immediately. If you're planning a trip abroad, do a quick search to find out if there are any outbreak of mosquito-borne diseases so you can protect yourself accordingly. And if you have symptoms including fever, headache, muscle and joint pain, see your healthcare provider as soon as possible. Now, there's a common misconception that a person can catch diseases like dengue and chikungunya only once. That's not true, as these illnesses have several strains. So, whether or not you've had it before, take the necessary precautions. Some people also believe that mosquitoes prefer certain blood types or only bite at certain times of day. There is no current scientific proof that either of these statements are true. While some species are more active at dusk and dawn, you can get bitten at any time of day. Remember, suit up by wearing the appropriate clothing outdoors. Spray up with repellent containing DEET, and be sure to contact your doctor immediately if you feel you've been infected with a mosquito-borne disease.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance, plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
In the height of the pandemic and all the community spread, I was scheduled to have a major procedure. The hospital needed pre-approval from your health insurance. I expected to have a lot of delays due to everything that was happening at the time. However, BAF was able to get my response in within a couple of days. This year, unfortunately, that procedure led me to have some complications, and I was scheduled to have another emergency surgery. That was on the weekend. The hospital mentioned that they did not have an emergency contact for BAF, so I would need to try and wait or pay for it out of pocket. However, I did have Mike's phone number. I was able to phone him on a Saturday morning. He was able to reach the person that handles the emergency line, and I was able to have my approval sent within the hour and have everything done and settled. Very thankful for BAF for their quick and speedy response despite the pandemic and the office closures and the work from home and all the other difficulties that we've all been facing in the last 2 years. Thank you, BAF.
BAF, that's BAF for life.
Welcome back. Here talking with our good friends from the HSA about kidneys and kidney function, and also what it means to be a dialysis patient. So let me ask Nurse Erlin, if I was a patient of yours and I had to come in there, walk me through the regimen that you would set me up when I'm coming in for a dialysis.
At the HSA, we service, how Dr. Lowe-Jones mentioned, we do hemodialysis. That is, the patient is been coming from home, will be set up with attached to the machine through a catheter or a fistula, and for a few hours to filter in the blood, removing the toxins and the excess fluid to the body. We enhance treatment. Patients come in, they can be watching television, feel comfortable, do their own homework for a few hours, and they will be doing the treatment. This treatment is every other date.
Okay.
Every other day. We have patients who come in Monday, Wednesday, Fridays. We have patients who come in Tuesday, Thursday, Saturdays. It's something very, the patient should not be afraid to do it.
Okay.
It's a life-supporting treatment for the chronic kidney disease. It helps you to sustain your life. It doesn't have much complication. At the dialysis, the HSA, we have a unit with 12 stations. We doing 3 shifts per day. We open every day from Mondays to Fridays, 7 in the morning until 10:30 in the night.
Wow.
We accommodate all patients on island because this is the only dialysis unit on the island. We also provide services for people who visit in the island in cruise lines and holidays, and
That
we
need services,
that they
right.
need the dialysis service. We also offer emergency service. We have somebody assigned to be on call to respond to any emergency in the event that somebody is in need. Are just enhanced to expand the dialysis service to the West Bay area.
Okay. So making it easier for the complete
the
island.
communities,
Right.
to ensure that we can provide the service and the people don't have to be traveling to
Different locations.
Different location,
Right.
yes. So in West Bay, we have set up 2 dialysis machines, and soon we'll reopen service there. So for those
Makes
ones
it
who,
so easy.
for those ones who live in the area can be accommodated, and we will beneficial for them, so they don't have to be traveling to Georgetown. We also are expanding service to increase the numbers of PD patients that we will be served.
Okay.
So we are in the process of creating a area for PD patients as well, so to enhance treatment, have a second modality of treatment, and provide a better service.
Of
Because
course.
PD service save the vessels for the persons to progression, and then when they transition to hemo, if it did not be transplanted, is save the vessels for the persons to when hemo is needed.
You have
this
the
is
transition right there.
yes.
Exactly. I think this is really great for our listening public to hear. If they want to inquire some information about kidney disorder, kidney disease, and also the treatment, how can they do that? How can they reach out?
We have a very good communication teams. All the inquiries can be referred to them. We also have a patient experience team that we have an email that you can send those inquiries. You can call the HSA.
Okay.
You can reach to the dialysis unit. We have a patient education program that every month we educate our patients, those ones who have risk factors who are not there yet. We bring them in, we talk to them, we put a comprehensive team including dietitian, pharmacists, physician, nurses, family persons, the same patients who are already in dialysis, to talk to them, to raise awareness, to decrease the fairness to be coming. Because
Right.
sometimes there is out there that dialysis is the end of life, or you will be
Right.
dead.
The
Yes.
information is that and I have to tell you the truth. I fall into that too, because when you talk about this, the community has always thought that this is the end, but it's not.
No, it's not.
And I think that's why we need to bring awareness and also the understanding that not to be fear-mongering, not to be fearful of this, that this is a sustainable part, that you're able to continue having a healthy life and healthy lifestyle.
To complement that, what you said, every year we do, in the working date, we do a health screening check, free of cost for the public, where we check the blood sugars, we check the blood pressures, we check the urine test, we check the weight and the height, because these are leading factors that it can, or risk factor that contributing to leading to the kidney disease. On those weeks, we have doctors who see the patient at free cost. We have dietitians who can give you advice at free cost. So we invite everybody to check on themselves. So when they go to the physician, ask the physician how I'm doing, what does my kidney function is,
Right.
how I am. So those things can help you to change your lifestyle, to do things that you don't reach to be having kidney failure or chronic kidney disease.
Thank you so much, ladies, for stopping by here and bringing awareness about kidney disorder. And wrapping up, what would you like to say?
I want to say thanks again for having us from the HSA Dialysis and Nephrology team. We want to just let the listeners know that kidney disease is a growing concern, and that aimed at providing education, advocacy, and counseling and support for our patients. We want it to be very patient-centered, because at the end of the day, the patient is what we're here for. And we just want to have your listeners be aware.
Definitely, folks. So Ladies, thank you so much for stopping by here this morning.
Thank you so much.
Thank you for having us.
I'm free to live my life, yeah. Free to be me, yeah. The way I wanna be. Doing the things that I wanna do.
Cause I'm living my life, hey, BAF for life. Yes, I'm living my life, hey, BAF for life.
For life, BAF has got you covered.
Today on Be Well, Be Healthy for Life, Lady K helps us prepare for hurricanes with our health in mind.
We all look forward to summer. Here in the tropics, that means more beach days, pool parties, family trips, and sadly, hurricane season. Now, we all have painful memories of hurricanes, but preparing for hurricanes is just a part of our routine. Making sure we have adequate supplies of non-perishable food, paper goods, and water stored is just a part of the drill. But there should be more to your hurricane preparations. The health-related items that are often forgotten until we sometimes need them. This hurricane season, don't get caught without critical supplies you may need to safeguard your health. Take inventory of your first aid supplies. Bandages, cotton swabs, antibiotic and antifungal creams, alcohol swabs, painkillers, and other first aid supplies can be very important in the aftermath of a hurricane. It is easy to get injured while you're shuttering your house before or you're trying to clean up after a storm. Broken glass from a shattered window or maybe loose debris can cause cuts and scrapes. And please remember, avoid standing water. There are many unseen dangers such as ringworm and other fungi, as well as a variety of bacteria that can lurk below murky waters. It's helpful to have your first aid supplies already on hand, so stock up before the storm. Be sure you have adequate supplies of your prescription drugs. You want to fill prescriptions when they're due, and then talk to your medical professional about your prescription drug supplies. You want to ensure that if a hurricane does threaten or hit, your health is not affected. Remember, power outages, flooded roads, and many other conditions may prevail after a storm. Stock up on healthy, non-perishable food items. Very often, the non-perishable food in our hurricane stocks are all canned meats and snacks that are loaded with salt and preservatives. Now, canned meats and, such as corned beef and canned soups are quick and easy to prepare during and after a storm because they can be eaten straight from the can or they need very minimal cooking. I understand. But these items have a large quantity of fat and salt, which are bad for your health. So canned sardines and mackerel are a better choice because these are dark fish which have high protein and omega-3 fatty acids. Nevertheless, they too can contain unhealthy quantities of sodium. So please, take the time to read and compare labels. The same goes for canned fruits, juices, and vegetables. Read the labels carefully. For canned fruit, choose those are packaged in natural fruit juices without any added sugar. And then for canned vegetables, look for ones that are packaged in water instead of brine, which is super salty. Choose 100% natural juices if you can. And if that's not possible, then choose the ones with the lowest possible sugar content. And also consider diluting them when you're drinking. As a general rule, when you're buying canned goods, always look for foods that are low sodium with no added sugars. These will be much healthier for you and your loved ones to eat while you try to ride out a storm. Let's talk about hurricane snacks. Everyone's favorite part of the hurricane supplies is the snacks, right? But instead of chips and sweet biscuits, consider some healthy snacks, such as dried fruit, nuts, and protein bars. But once again, read the labels. Even dried fruit can sometimes contain added sugars. And because dried fruit typically contains a larger concentration of sugar, this is caused, of course, by the dehydration process, you really have to be cautious. Nuts are always a good bet. And protein bars can be filling and they offer sizable nutrition in small quantities. Hurricanes are a part of living in the tropics. We sadly can't avoid that threat that often looms over our islands. But what we can do is to be prepared as best as possible. So this hurricane season, we truly hope we can escape being hit by a storm, but let's still prepare with our safety and our health in mind.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.